Hi there. In our last lecture, we talked about how you can formulate testable research questions. And today we're going to take that to another level in terms of how to pick a research design that fits the question and the resources that you have. Study designs are of two basic types: experimental designs, where the experimenter has control over the selection of the intervention, and observational designs, where you're studying the way treatment is conducted in the real world without having the ability to manipulate the way that things are done. Here's a diagram of epidemiological study designs. And on the left-hand side, you'll see experimental studies. On the right, observational studies. Observational studies in particular consist of just descriptive studies that are conducted by describing the treatment facilities, personnel, programs, patients that are out there. And often you may have access to large data sets that would be important to evaluate in order to understand what types of treatment services are being delivered and ultimately how many patients are accessing those services. Descriptive studies can often be based on cross-sectional surveys of patients or facilities, like we've seen in some of the World Health Organization surveys that are conducted internationally of treatment systems. Another type of observational study is analytic studies, where you might have some hypothesis or research question in mind, where you might want to follow cohorts of patients who are coming in to one program and see how they do in terms of outcomes at 6 months or a year in relation to patients coming into another type of program. And analytic studies can help you to evaluate whether patients like one program more than another, or whether they do better in one program compared with another. So we can get useful information out of observational studies. For the remainder of this talk today, I'm going to focus on experimental studies. And they are generally categorized in terms of randomized controlled trials and quasi-experimental studies. So let's start with randomized trials. A randomized trial is where the study subjects are randomized to either an intervention or a comparison group. And the intervention group receives, for example, a new therapeutic or preventive intervention, where the comparison group either receives no intervention or a placebo, as in a drug study, or a standard treatment. So that's the standard randomized clinical trial that's used throughout medicine and often in psychotherapy studies and pharmacotherapy studies that are used with people who have difficulties with alcohol and drugs. Another variant of the experimental design, randomized design, is called cluster randomization. And that's where the unit of analysis is not the individual patient who gets randomized to one condition versus another, but it's a group of patients. And perhaps the most significant and important example of this is in studying group therapy. In order to study group therapy, you don't only want to study individual patients, you want to study groups of patients, because there's something going on at the group level far beyond the effect of the intervention on the individual. So what you do is you have one group of people who have treatment A and another group of people who have a standard treatment, but you randomize groups, and you could have 15 groups with a intensive outpatient group therapy that incorporates cognitive behavioral skills training, and that would be compared to 15 groups who get just standard group therapy. You would randomize the groups rather than the individuals to these two conditions. And that is what is called a group or cluster randomized study. You could also randomize programs. If you wanted to include the addition of methadone maintenance to an outpatient program for people with opioid dependence, you could see what the outcomes are on 15 programs that are receiving the additional medication-assisted treatment compared to the programs that just have standard outpatient counseling. Another type of experimental study is quasi-experimental. And the quasi-experimental study takes groups that, for some reason, differ in one important respect. An example would be that a new program element is introduced to one program but not another. And when that new program element is introduced, you begin to see changes in patients' outcomes. A quasi-experimental study is not under the control of the experimenter. So you go back and you often are looking at data that's already been collected because you didn't decide when to introduce that intervention. But you know that it seems to be making a difference. And this kind of study, which is called sometimes a natural experiment, is very effective if you can find a program that has that introduction of a new element or a new program intervention compared to a very similar program with similar patients that doesn't have it. And the way to decide that is to find programs where something has changed. It's a good substitute when you don't have the opportunity to do a true randomized experiment. And often if you can control for all other factors other than that change that was done in the program, you can make inferences which are as good as you would be able to make from an experimental study. To summarize, experimental designs are the gold standard for evaluating efficacy in an ideal manipulation of a new treatment and effectiveness by looking at new treatments that are introduced in the real world. But they're not always easy to do in clinical research for ethical reasons. Quasi-experimental designs can sometimes be as valid as experimental studies. So sometimes you can find programs that have been introduced and for that reason do an evaluation of the changes if you can find a suitable comparison program. And finally, observational study designs are important for health services and systems research when you're looking at the big picture. You want to describe what is going on, you want to develop hypotheses, collect information, and look at how the system is functioning, often on a population level. All of these designs are useful, and they need to be appropriate to the research question that you formulated.